Once again, I want to thank the media for joining us today. We much appreciate the goodwill and cooperation to get our messaging out. I'm starting off by wearing a mask today to remind you how important it is that people wear face coverings. I will say that my assistants in the room are all wearing their face coverings, but I am going to take it off for the rest of this because it does fog my glasses up and makes it a little bit hard for me to read off the paper. Just starting off with some highlights here. Currently across Northern Light Health's 10 facilities and our home care and hospice, we have 9 confirmed individuals who we're caring for with COVID-19. 6 of those are at Eastern Maine Medical Center and 3 are at Mercy Hospital down in Portland. I'm happy to report that currently home care and hospice no longer is taking care of any individuals who are actively infected with COVID-19, and that's good news because those patients have recovered, and that's nice for us. I do want to talk about some good news for us. About a week ago, we launched a digital thank you board to give community members and employees an easy way to say thank you. It's been quite a success so far, and we're thankful to everyone who has contributed. Here's a couple of sentiments that have been shared with us. I would like to say thank you to the entire team at Northern Light Allergy. They take such wonderful care of my daughter and make her visits so patient-centered. While a visit can be scary for a 3-year-old, my little one left with stickers in her hands. Thanks for taking such good care of my little one who has some scary allergies. And here's another one. A huge thank you not only to my PEDS primary family, but to everyone who continues to want better for the community, to everyone who came back to work, to everyone who just simply shows up. You are amazing, and you are appreciated more than you know. These messages really make a difference to our staff, and if anyone would like to contribute, they can visit us at northernlight.org/thanks. I do want to talk a little bit about testing. The governor made a great announcement yesterday of a new partnership between the state and a company called IDEX Laboratories that we hope will be able to triple Maine's coronavirus testing capacity. It'll be about a week away before they can start doing that, but that additional testing is very important. Details as to how that's all going to work are being worked out, and we certainly will share that along with the state as we get more information. This additional testing is good for us and good for the state of Maine. It'll certainly help us in the short run whenever we have an outbreak, such as at a long-term care facility or other congregate living situation, and being able to test individuals in those facilities a little bit faster. We do know that increased testing is vital to both continued good health care and safety strategies, as well as to reopening our economy, and we are very happy to partner wherever we can in that. This increased testing does mean that we will have a clearer picture of how this virus is spreading across our communities and help us to make decisions as it spreads. And that leads me into, as we begin to ramp up the services that we provide across Northern Light Health, and particularly around the area of elective procedures, tests, and visits. Our focus will continue to be ensuring that our communities receive the care that they need and that they do so in a nice, safe environment. We've talked about our plans in a more general sense, and I'd like to share some more specifics today about the work around elective procedures. Our initial focus will be on patients whose care has been postponed for 30 to 45 days, and it is in their best interest to be seen by a provider, have surgery, or undergo particular testing. Our timelines are certainly subject to change due to testing availability and other factors, including a potential resurgence of the COVID-19 virus across our communities. We are currently working towards reaching 50 to 75% of our pre-COVID-19 volume within the next 2 to 4 weeks, though, and things will look a little bit different when you come to each of our hospitals. At that point, we will certainly assess a path as to how we get back to 100% capacity. But again, use this as a reminder that when you come into our facilities, we may look a little bit different. All of our staff will be wearing procedural masks, and some will be wearing even further personal protective equipment for their safety and yours. And we encourage you that you need to bring a cloth face covering when you come to our facilities. This is both in keeping with the governor's executive order as well as in what we feel are good, safe practices in order to protect the safety of our individuals, patients, staff, and providers. And so we thank the community for being supportive of those efforts. I did want to address just a couple of myths that I've seen out there. There was some things making the rounds that particular antihypertensive or high blood pressure medications may put people at severe risk for COVID-19 or make their symptoms more dramatic. And those particular medications went by names like lisinopril, enalapril, losartan, valsartan, or Cozar. I want to assure the population that those were initial findings that have panned to not be accurate, and we do not feel there is any safety concerns. And as I've said multiple times before, if you currently have a chronic illness and are prescribed medications, please continue to take them as your provider has prescribed for you. And if you have concerns or questions, to reach out to your providers. With that, I think we'll open it up for questions.
Hey, thank you very much, Dr. Jarvis. First on our list for questions is going to be Brian from WABI. Just give me a second. Unmute you, Brian, and now you should be all set.
Yeah, I'm sorry, that was a little quick. You can. I'll pass this round if you can come back to me.
Okay. Yeah, we can do that, Brian. No worries.
Sorry.
If you want me to keep talking, I will, Brian.
Okay, we'll move on to. It looks like Leslie from Penobscot Bay Press has joined us. Leslie, just there's a few more people on in this call, so just give me a second to find you and unmute you. And if it'll let me unmute you, Leslie, hold on. Okay, looks like we're all set.
I know, you're going really fast, and I had to look up my question, which is whether on-demand testing will be available at the Castine and Stonington clinics and at the Blue Hill Family Health. And I'm also curious whether Northern Light plans to do sentinel testing.
So at this time, we will continue the same process that we have been doing. There has been a little bit of a change in some of our swabbing sites at some of our facilities across Northern Light. We are not stopping those swabbing sites. We just have moved some of them from the more temporary tent-like facilities into a hard facility that we can use long-term. But we will continue to have those sites available. I will remind everybody that both the governor and Dr. Shaw yesterday did state that it will take a provider's order in order to get testing done, and we feel that is in keeping with what we have been doing with Northern Light Health as well. And so if a provider feels that a test is necessary, we will go through the same process of them putting in an order and then referring a patient either to our nurse triage line or to one of our swabbing centers across the Northern Light facilities. Thank you.
Okay, next up we're going to go to Charlie from Bangor Daily News.
Hi, Dr. Jarvis. I apologize. I missed I missed actually almost everything you said. So I apologize if this has kind of been, I got here a little bit late. Just continuing on that last question, you said that, providers will have to basically, order tests for any, expanded testing across the state. And do you, can you just speak at all in more practical terms about what difference this could make, in the next few weeks for providers who are seeing patients in terms of the ability to do more testing?
Can you all hear Dr. Jarvis?
I cannot hear him now.
Okay, Dr. Jarvis, for some reason we just lost your microphone. Hold on, Brad. You can always text in the box too. What were you saying, Brad? Hold on, you're muted, Brad. Something's going on here. Bear with me, folks. Apparently there's some gremlins in the system. What's up, Brad?
Can you hear me now?
I can, yeah.
See him either.
Can you hear Dr. Jarvis now?
And I can.
Okay, we can hear you now, Dr. Jarvis. Yep.
Very good.
Do you want to repeat the question? You need Charlie to repeat the question,
No,
Dr. Jarvis?
I think, yeah, the question was with the expanded testing capabilities, not only at the state lab, but also at Northern Light Lab and other facilities across the state, what will that mean in terms of testing, and will we see dramatic differences over the next couple of weeks? remember that there were certain individuals that we would have liked to have tested as clinicians who currently are not getting tested. And so those will be the individuals that will probably see the benefits of this sooner rather than later. In particular, when we have outbreaks at long-term care facilities, right now it's kind of been a shared effort with multiple agencies, though the state has taken the lead on those, that this will make it so that in a more timely fashion they can test those individuals. In addition, we would like to increase testing of particular populations of individuals across our Northern Light entities and other hospitals across the state. In particular, we'd like to get to a point where we can test more individuals who are being admitted to the hospital who may not be suspected of COVID-19. We also know that in order to protect both our staff and our patients, we will need to do some amount of testing of asymptomatic individuals who have planned tests, procedures, or operations going forward. And so that's where we will probably see over the next couple of weeks, we will see an increase in those categories of individuals that we are testing. In addition, if there are individuals out in the community who are at high risk, who have symptoms of COVID-19, we may see that they get tested now, whereas before they were being prioritized behind those tier 1 individuals that we had talked about in the past. So I think over the next few weeks we'll see some ramping up of testing, but it will not be a point where we will be testing everybody in the state of Maine. We will never have that kind of testing capability. We really need to make sure that we are doing things in a safe and clinical fashion. So thank you for that question.
Hey, Charlie, you got one more question if you'd like.
Sure. Just and related to that, does Northern Light, and I apologize again if you addressed this already, have sort of adequate supplies of testing swabs and the media to carry them?
So currently we feel that we do. We have the ability right now to actually increase some of our testing capacity this week and look forward to being able to increase even further than that in the coming weeks, particularly as we head into June. We do feel that we have not only an adequate supply on hand, but also adequate supply chain to continue to bring those critical reagents and swabs to us. But that is always at risk and something that we monitor on a daily basis.
Okay, thank you for your questions, Charlie. We're going to move on to WGME, Brad Rogers. Oh, hold on a second, Brad. There's definitely some gremlins in the system today. I think you're all set now.
I think I am now too. Yeah, I have a couple of questions if you don't mind. First, Doctor, how do you feel about eliminating the tiered priority testing and allow anyone who needs a test to get one? And do you believe it's safe to move up the timeline to reopen businesses once the new testing gets online?
So I'll answer the first question, and then I'll try to answer that second one. So the first question was, how do I personally feel about relieving the testing criteria, the tiering criteria that we have done? I think it is good news that we'll be able to test more individuals for a number of reasons. One, for those particular individuals, it may make a difference in their clinical care, and that's a good thing for us to be able to do that. But more globally, it'll help us to realize where the spread of the disease is in our communities currently. As we've said before, we have been, because of the low number of tests that we've been able to perform, we really don't have the greatest sense of where this virus is located within our communities, and being able to test more individuals will help with that. As far as reopening businesses, this could be a twofold issue for us. The first being that, yes, it is important for us to know where community spread is, so we know where safely we can open up particular parts of our industry. But at the same time, we also know that that may result in having increased number of cases that we know of, because we are testing more individuals, and as we test more individuals, we know we will find some positives out there. We have never been shy about saying that we feel this virus is out in our communities, and there are people out there who are asymptomatic, meaning they have no symptoms, or pre-symptomatic, meaning they haven't shown those symptoms yet, who are shedding virus. And that's the important reason why we need to continue doing all those great things like social distancing, good hand hygiene, including washing our hands frequently or using hand sanitizer, and then wearing those cloth masks or cloth face coverings when we are out in the community to help prevent the spread from one person to another. And that's really important, because you don't know if you're infected right now, and I hope that if you are, that you remain asymptomatic. But what we don't want you to do is to spread that virus to anybody who's at high risk, particularly the elderly population, those with chronic illnesses who may not be able to fight the virus off on their own. And so that's the reason why we're doing all the things that we're doing, and certainly testing will help us to reinforce that message.
Thank you very much, Brad. We'll get back to you at the end. Okay, Brad? Okay, if we have time, we'll get back to you. Bob, why don't you go from New Center, Maine?
Hi, Dr. Jarvis. Good afternoon.
Good afternoon, Bob.
The governor's announcement and the increase in testing. I know details are still being worked out, but do you expect that to happen at your facility in Bangor or at Bass Park at the testing site that's out by Bass Park?
So again, the testing site out at Bass Park, they don't actually run the tests there, they just collect the tests. So it'd be like going to a lab draw station and then having your blood work shipped to a lab. That's what happens out at Bass Park. So the question was, do we feel that we will be running those tests that the state talked about? And no, actually in Augusta, they have a state laboratory there, and the new machine that they already have in place, and the second one that's coming, will be done all at the Augusta State Lab, and we will partner with them, and we have in the past that we have collected specimens and then sent them to the state for processing, and we anticipate that that will continue. And so we may see some increased activity at some of our swabbing stations across the state as, again, we relax some of the tiering criteria. So we do expect that, and we're prepared for it, and we will work together with the state on that. So thank you for that question.
Thank you.
Okay, thank you, Bob. Next, I'm going to move on to WVII. That is TJ Tremble. Just give me a second to find you on the drop-down list here, TJ, and you should be all set.
Thank you, Chris. Dr. Jarvis, good afternoon. How are you?
I'm well, TJ. How are you?
Excellent. I know you've mentioned Bass Park a little bit. Do you have any figures on how many people are being processed there on a daily basis?
I don't have any exact figures for you, TJ. The question was how many people are going through our Bass Park site. We look at those numbers, and it's usually typically between 20 and 40 a day, but it is quite random. Mostly it has to do with where we are in the work week, because we have been sending certain individuals there for testing prior to some of our elective procedures and operations, and so some days there's an increase because of that. And then sometimes there's been an increase simply due to some of the outbreaks that have occurred around town, and so it's been very variable.
And also, somebody wanted me to ask if there's been any statistical analysis of whether people testing positive for COVID have had the flu or a flu vaccine this year.
So I'm not aware of anything formal on that. I know that when they originally started having outbreaks in Washington State and then in New York City, people were looking into that to see if maybe if you'd had the flu vaccine, if it offered any amount of protection. As we've talked about, this virus is a coronavirus where influenza is an influenza virus, and they are distinctly different. And so the vaccine in and of itself should not give any particular protection. What we think its benefit is that if somebody had come down with both the flu and coronavirus or COVID-19 at the same time, that's kind of that double wallop and could probably have led to more severe disease. We are very fortunate that our flu season was not only mild but also very short here in the state of Maine, which we do feel actually helped contribute to our flattening of the curve, and we appreciate all the things that people have done to help flatten that curve, but that was one factor in it, because people weren't generally sick from the influenza virus, and therefore if they did contract the COVID-19 virus, they may have been better prepared to fight against it. But I don't think there's any relationship that we've found between the actual vaccine for influenza and your immunity or better way to protect yourself from COVID-19.
All right, thank you very much, TJ, for your questions. Next up is Amy Brown from WERU. Oops.
Thank you. Oh,
Yep.
Am I there? Okay.
You're all set.
Thanks. Dr. Jarvis, do you know what the status is of antibody testing? I understood that the last time I asked about this, that the tests were not considered reliable enough for most medical professionals to feel like they were worth pursuing. Is that still the case?
That is still the case. There has been some good news on that horizon over the last week. As some of you have reported, the FDA did come out with a much stronger statement than they had in the past about serologic testing or antibody testing. That there were some 200 plus companies that had marketed those tests, but very few of them had gone through any kind of scrutiny or validation that their process. And so the CDC is really and the FDA, has really recommended that you not utilize those testing capabilities. But there has been some progress with a few companies that have developed tests that have better scrutiny and more validation, but right now nothing that's ramped up or ready to go on general market use for clinical activity. There may be some pockets where we're seeing that activity happen, particularly in large cities where they know that there's been a large number of individuals who've been infected with COVID-19, and using that more for research purposes than testing that would help us from a clinical standpoint. We are hopeful that as the summer months come on, that we will have a serologic-based test for both the antigen, meaning looking for the virus itself, or antibody, looking for the proteins that your body makes to help fight infections, and that will be useful for us clinically. Right now, though, the thing that's most clinically useful is the test that we are currently doing, which is a PCR test, and that's the one that requires the nasal swab, which may be uncomfortable, but is the most accurate way for us currently to diagnose if somebody has the actual virus right now. So thank you for that question. More to come. And I apologize. I used to be a microbiologist, so sometimes I get excited talking about the microbiology aspect of this virus.
No, that was really helpful. And also, a few weeks ago, there was discussion of sort of field hospitals. I think they were called alternative care sites at the cross centers in Portland and Bangor. Did those ever get up and running? It doesn't seem like they were probably required. And if not, are they on standby in case we see a surge as we're starting to open things up?
That is an excellent question. So it was about the alternative care sites that we had talked about at both the Cross Insurance Center here in Bangor and the Cross Insurance Arena down in Portland. So you are correct. Because we did such a great job in flattening the curve in Maine and kept our number of hospitalized patients with COVID-19 under control, we did not need to stand up either of those two facilities. We were also grateful that there's been some community members, particularly hotels, who have opened their doors for individuals who needed to be isolated but were not able to return home, and so that has helped us. I will say that the staging plans for both of those facilities are still ready and can be turned on if we needed to. So if we did see a second wave of this virus and it was worse than our first one, requiring multiple hospitalizations and limiting where we could transfer patients once they convalesced, we could stand those facilities up, but thankfully we never needed to, but the plans are in place. And what the good news for that is that if there is another pandemic of some other order or some other major crisis that requires us to have additional housing, those plans are on the books, and we have a very well thought out way of ramping those up and putting them in place. And that's good news for the community, that we are prepared in case we need them. Let's all be hopeful that we never do.
Hey, thank you very much for your questions, Amy. I'm going to move on to Brian over at WABI if you have a question now. And also at this time, if I know we might be able to take one or two follow-up questions. If any of you have one, just let me know in the text box that you have a follow-up question. I'll try to get to you, Brad. I know that you have one, so I'll put you on the list. And Brian, you are unmuted now, so if you got something, go for it.
Yeah, Dr. Jarvis, thank you. I was wondering if you could just, I apologize, if you could just repeat the numbers you read at the beginning of this press conference when you started.
Sure. So Brian just wanted me to ask to repeat the numbers that I had. So right now, within Northern Lights 10 facilities, we have 9 confirmed cases of COVID-19 of individuals who we are actively caring for. 6 of those are here at Eastern Maine Medical Center, and 3 are down at Mercy Hospital in Portland. And currently our home care and hospice are not caring for any individuals at home, and the ones that we had talked about before have recovered. I will say that we have performed about 5,500 tests at Northern Light Lab with 179 positives, and at last report we had 10 individuals across our hospitals who are currently under investigation, meaning that we have tested them but we've not gotten the results back.
That's all I have. Thank you.
All right, thank you very much for that question, Brian. Okay, so Brad, it looks like you can get a chance to do your follow-up now. Just give me a second to unmute you, and now you can go for it.
All right.
I think we lost him.
Brad, hold on. I don't know what happened. It seems like your mic went out. Hold on.
Hi.
All right.
You hear me now?
Yep, go ahead,
You
Brad.
can hear me now.
You mentioned you had some patients in the hospice who've recovered. How many patients were there, and do you know what led to the turnaround there? Amazing.
Yeah, that's a good question. And the question was, how many people did we have in our home care setting that we were caring for? And I actually don't know the total number because that number changed over time. I will say that these were individuals who, for the most part, did not require hospitalization, so they were that moderate level of disease, and therefore were able to be cared for at home and then thankfully recovered.
Okay.
If I can get more details, I will certainly share those.
Okay, thank you. And really quickly, Dr. Jarvis, I believe I have a follow-up question. I'm just going to read to you from TJ at WVII.
Okay.
And the question is, how useful is the 14-day quarantine for people coming into the state?
Yeah, that's a good question. And the question was, how useful is the 14-day quarantine for somebody coming from out of state into the state of Maine? The issue there is that we know that the incubation period for this virus is somewhere around 14 days, so about 14 days between the time that the person is infected and when they start showing symptoms. So it is important that we continue to follow the governor's order on that. As you know, pretty much every other place just south of the state of Maine has been hit pretty hard, particularly in New Hampshire, Massachusetts, and New York. And so we know that if those individuals were to travel here, there's a good chance that they were exposed in their particular communities. And so having that period of time where they are self-isolating is important so that they are not out in our community and spreading it to those, particularly in those areas where we have not seen some widespread disease already. If you think about it, most of these individuals are going to go back into our more rural counties for a second home, and we really don't want them spreading disease out into areas where we haven't seen widespread disease. So that's the importance of that particular mandate.
Okay, Dr. Jarvis, thank you very much for your time. If there's no other questions, members of the media, I will wrap this up. One thing I would like you to do for me, if you want the copy of the video, just, I know New Center Maine, I know you want one, but anybody else who wants one, just send me a message in the text box now, or if you think of it later, just shoot us an email. Okay, Brad, got you with the thumbs up.
Thank you all once again, and we appreciate everything that you have done to help present truthful and accurate information so that your viewers and readers can get accurate information. So we appreciate that. Thank you.
Okay, thank you, Dr. Jarvis. Thank you all.